Hey there, Dr. Christianson here. I want to talk about a hugely important topic that affects almost all of us, pills for chronic conditions. Over 61% of American adults right now use at least one medication to treat a chronic health problem. This has gone up more than 15% in the last few years. So seniors actually, most are taking now at least 5 medications, and many take a dozen medications or more. And the assumption is that these are protecting you from some outcome. So the main 4 areas that this is relevant to are blood pressure, blood cholesterol, blood sugar, and bone density. So blood pressure, we know that there's a higher risk for stroke with high blood pressure and other complications. So the assumption is that in taking a medication to lower the blood pressure, we will lower the risk for stroke as well. And it seems logical. It seems that that should happen. It seems to make sense. But we have enough data now to draw on to look back at large numbers of people for large numbers of years and say, how much did that outcome change? How much by changing that marker of blood pressure did we change that outcome of stroke? How much did it actually shift? Or in terms of cholesterol. You know, there was a woman that asked one of my doctors not too long ago what could she take instead of her Lipitor or her Crestor? What could she take to lower her cholesterol instead? And the assumption there was that she didn't like taking, I think it was Crestor actually, she didn't like taking it, but she felt that she needed to. She felt that it was protecting her in some way or keeping her safe from something. And so they talked to her about the real numbers and the real data. And what happens is that the marker of cholesterol relates to the outcome of a heart attack more than anything. But the change of heart attack risk by lowering cholesterol with the medication is so much smaller than people would ever imagine. So there's 4 categories of people. We've got men and women, and we've got those that have had heart attacks, those that have not. So if someone's had a heart attack before, we talk about being secondary prevention, their treatment goal. We're trying to prevent the second heart attack. If someone's not had one, we're trying to prevent their first heart attack, so primary prevention. So you think about men and women, primary and secondary prevention. This was a woman who had not had a heart attack, so her goal was to prevent the first heart attack. So what are the odds of the medication being helpful in a case like that? What are the actual numerical odds? Well, if you take roughly 300 women here and another 300 women here, all of whom have high cholesterol, and you put this group on a statin medication, this group you do not, and you watch both groups for a decade, the group with the medication would have perhaps 1 fewer heart attack than the group without the medication. So the odds are 1 in 300 that it could be helpful. So that's the odds of the help. Now the odds of harm are much higher. So liver damage, brain damage, memory loss, nerve damage, those things are upwards of 20 to 30%. And that's not counting the fact that we're also raising the risk of developing diabetes through the statin medication. So the odds of harm are orders of magnitude greater than the possible odds of help. So this thing is really not protective in the way we would think it is. You could still get a heart attack. Your odds are lower, yes, but not by that radically large of a degree. Then we think about other conditions like the blood sugar I mentioned. So from so many large studies that have been done primarily by the drug companies, they may be optimistic at best, but they're by no means missing out on some large benefits. So in the case of diabetes, for example, we think about the big complications being heart attack, stroke, blindness, limb amputation, and then death, just death as a total side effect. So if you have someone on aggressive management of blood sugar with medications, the odds of those things improving, let's pull out limb amputation from that list. So not limb amputation, but the blindness, the heart attack, the stroke, the total death. The odds of those improving by medically managing the blood sugar are sadly 0. There's no clear odds of improvement whatsoever. If we pull back in limb amputation, the odds are 1 in 250. So for every 250 people treated with medications, you'll see 1 fewer case of limb amputation than you would for a similar group that were not treated. So that's abysmal. And that's also not taking into account that as many as 1 in 6 can be at risk for dangerous, possibly even fatal hypoglycemia that requires hospitalization. So 1 in 6 can take major harm, and 1 in 250 can have some possible benefit for one of the 5 major complications. So this is not effective. And the same thing holds true to a similar degree for blood pressure medications and stroke risk, and also medications for bone density and hip fracture. So we've got to separate the marker from the outcome. And it's the outcome that matters. The marker is a convenient tool. The marker is easy to track for a lot of people for a brief period of time, but the outcome is all that matters. You know, I thought about this analogy. You can imagine that we lost a young man with a family. We lost him to diabetes. And here we are at his funeral, and we're hearing his eulogy. And the pastor's saying, it's how tragic is it that we lost this gentleman to this horrible condition and the prime of his age with people that need him and cared for him. But we can all feel rest assured and take comfort in the fact that he had good blood sugar levels because of the medication. No, we wouldn't. We would take no consolation in that whatsoever. But that's all we're getting from medication for chronic disease is improved markers. We're not getting changes in outcomes. 61% of people are on these medications for these conditions. And they're being lied to. They're being misled. They're thinking they're getting something that they're not. And it's completely shifting their behavior. You know, if you knew that you were laying in the train tracks, you would do something about it. But if someone convinced you that you were actually in a 5-star hotel, you'd ignore that rumble. No, these are the train tracks. The idea about going deep in your lifestyle and making the hard changes and things that aren't clear and sorting it out, it's mandatory. If pills did work, I'd be handing out pills if they were effective. That'd be fine. I would have no concern. I wouldn't feel bad about that. There's no moral reason why it wouldn't be okay to take a pill. I like treating the cause, but if a pill worked just as good and got the same outcome, why not? But they don't. They're not effective. So please know that. They're a false sense of security. They're causing harm. They're causing side effects. They're taking you away from seeing the dangers that are facing you. And it's the same thing for your loved ones. So anyone who's on medications for these conditions, share this with them. Tell them about that. And please help them to get deep into the real causes and get on a proper path to turn things around for the rest of them. Take great care of yourselves. Dr. Christianson here, and I'll talk with you really soon.